Hello, everyone. Welcome.
Hey, everyone. Thanks for joining us this evening. My name is Kim, and I work with Dr. LoSasso and the team. I'm often one of the first people you guys speak to in the process, whether you reach out via email or phone call, and I help get you set up with the initial consultation with Allison and answer your questions. For those of you that have joined the webinar series in the past, welcome back. Thanks for taking the time to join us. And for those of you that are joining for the first time, we're so happy to have you guys here. We know that the Pectus journey is a complicated one. It can be a long one. It can be a lonely process. And we came up with this monthly webinar series a few months ago, and the idea is to have a monthly webinar with hot topics, requests from you guys, and a live Q&A with Dr. LoSasso, but also to provide a community forum for the Pectus community for any questions you guys may have, and also to help connect you with people that are in similar situations. We're so lucky to have our third roundtable webinar this evening, and this is going to be an adult roundtable. So we have 5 former patients of Dr. LoSasso's, and they're going to be sharing their story and their experience. We have not directed them to say anything or not say anything. They're going to be sharing their honest experience, and we encourage you guys to ask. For those joining, to ask questions to them. You can ask questions directly to somebody that shared their story. You can ask questions to the group. Don't be shy about asking questions. I'm sure that this group would have loved to have an opportunity like this to talk to somebody that went through it while they were going through it. So again, we encourage you to ask questions. You can also ask questions to Dr. LoSasso. Different ways of doing that. You can type it into the chat box, and we'll address it at the end of the presentation, or once the presentation is complete. Kate will explain how to do the raise hand feature, and we'll go. You'll be able to ask your question through the microphone that way. So without any further ado, we'll go ahead and get started. Dr. LoSasso, as always, will provide some information before everyone shares their story about the differences, or about Pectus, about kind of the basics of Pectus, and also the differences between operating on pediatric patients and operating on adult patients. So with that, I'll go ahead and pass it over to Dr. LoSasso. Thank you guys so much for joining us tonight.
Thanks, Kim, and good evening to everyone. Really appreciate your interest, and I think we have a wonderful webinar this evening to share with you. As Kim mentioned, we've done roundtables now in the past, one with parents addressing issues regarding the concerns of parents with children with Pectus who were considering the Nuss procedure, and that was very well received. And then one on athletes who have undergone the procedure and how the procedure itself, Pectus and the procedure, impacted them. So I would encourage you to go to the website if either of those two webinars seem at all interesting to you. Please go to the website. The website has all the past webinars that we've done, and I encourage you to use it as an educational resource. Tonight, we're going to talk about the adult experience, and I think that this is a very unique group of patients with unique stories to tell, and unique challenges that confront both patient and surgeon in addressing the needs of an adult patient. So we want to fully explore those differences and areas that are unique to the adult experience, and answer any of your questions at the end. For those of you who've participated in these webinars before. I'm going to go through a very, very short description of the different types of Pectus and just basic information that anyone who might be joining for the first time would benefit from having as we go through the subject area. So if I could have the first slide, please. So this is my educational background. I went to college at Yale University and medical school at the University of Florida. I'm board certified in general adult surgery and pediatric general surgery. My professional background included a fellowship in New York City at Columbia Presbyterian Medical Center and the Babies Hospital. And for years, I was the director of the chest wall deformities program at the Rady Children's Hospital in San Diego, and also directed an adult program at the adjacent adult hospital, Sharp Memorial. I was directly mentored and trained by Dr. Donald Nuss, who worked at the Children's Hospital of the King's Daughter in Norfolk, Virginia. Next slide. I've been doing this for over 20 years. I've done 1,000 plus Nuss procedures, both on kids and adults. The age of patients I've done in the past are from 12 to 52, and about 20%, maybe a little bit more, having come to the East Coast. I am doing a bit more adult surgery than I did on the West Coast. So somewhere between 20 and 25% of my patients are over 21 years of age. I moved my practice to the East Coast in 2017, and I've been operating exclusively on Pectus at the Valley Hospital in Ridgewood, New Jersey. There I operate on both young adults and adults. This is the front of the hospital. It's a lovely community hospital that does a lot of surgical specialty work, the Nuss procedure included. Next slide. This is our team that I'm so blessed to work with. Allison Tan is our physician assistant. Kim, you've just met. Kim often will be the first point of contact if you contact us through the website. And then the handoff will be to Allison, who will then do some brief history taking and then schedule an appointment with me. Linda Banca is our insurance specialist. Georgia Cristados is our scheduling and logistical person within the practice, and she's assisted by Linda Bliss. Next slide. We'd like to go over the sort of Pectus overview, the fund of knowledge that I think will be helpful to you if this is the first time you've attended one of these webinars, or if you're just coming to the realization that you have Pectus as an adult. We'll look at the considerations and nuances that are unique to the adult surgical experience. You'll meet the patients. They will present their experiences individually, and we'll follow up with a question and answer. Next slide. Pectus is a genetic condition, and as a result, it causes an excessive growth of the costal cartilages, which are the cartilages, the ribs in the front of the chest are made of cartilage like the tip of your nose or your ear, and those cartilages are unique within the body and are genetically predisposed to growing abnormally if one has the genetics of a Pectus individual. And the ribs in the front will then grow abnormally and cause a buckling of the rib. When that buckling is inward, it's a excavatum deformity, the one on the left. If it bows out, it's a carinatum, sometimes referred to as pigeon-breastedness. And lastly, if there's a bit of both types, the so-called mixed deformity, that is called Pectus arcuatum, and that's less than 1% of patients. Pectus in general is the most common chest wall deformity, and it affects 1 in every 350 to 450 people on the planet. And so it's fairly common. It's about twice as common as cleft lip and palate. It affects both men and women, though men much more commonly than women in a ratio of 4 to 1. Next slide. So it's important to understanding kids, which we're going to define as 12 to 18. There are the following unique characteristics. There's still a work in progress, so therefore the deformity has not fully expressed itself. So the chest has not reached its maximum depth. The chest is still very flexible as part of being a child and still growing. And other comorbidities or serious other medical conditions are much less common in the younger age group than in adults. These children tend to be more fit given their age, and they generally have less severe symptoms. And in this age group, the most advantageous period of time to intervene is generally between the ages of 13 and 15. Again, these are generalizations, but children tend to have less pain, they recover faster, and incidentally and specifically because they're still growing, the bars may need to be in a little bit longer than the average length of time, which is 3 years. Next slide. Again, adults as defined as over 18 are no longer growing, so their deformity is at its maximum severity. As a result, the chest wall tends to be, as a result of being more mature, is stiffer and less flexible. There's more muscular development, so the chest wall is heavier. And of course, all of this then often leads to the need for more force to lift the chest into its corrected position. So a maximum amount of therapy, meaning bars inserted into the chest in order to lift the chest. There may be the need to also use the instrument that's depicted on the slide, which is called a rule track retractor. It's an instrument that anyone doing adult surgery needs to be very, very familiar with and facile with, because it's the use of this instrument to forcefully lift the chest that provides a level of safety which is absolutely necessary in the adult patient. So in adults, I tend to use this forceful distraction technique much more often than I do in kids. There are also, with adulthood comes other medical conditions and comorbidities. And then the whole aging process tends to reduce cardiopulmonary fitness and combines with the inefficiencies of Pectus excavatum to cause more symptomatology. And as we mentioned, multiple bars are more common, longer operating times, and last but not least, it's critical that anyone who does this work not only has familiarity with doing the Nuss procedure, but has familiarity with doing the Nuss procedure on adults for all the reasons that I just mentioned. Next slide. So post-op pain management is similar in adults as what we do in kids. And that's important for adult patients to understand, that there's no special pain management for adults. It's just the appropriate amount of pain management needs to be applied to the adult patient, just as the same is true for children. The same time frame in terms of physical therapy also is appropriate for adults. That usually starts about at the 3rd postoperative week, and it lasts for 8 weeks, and it's usually 2 sessions a week. There are work-related issues. I'm sure that some of the adults who are going to be speaking to you today will discuss return to work and their other activities as they describe their individual journeys to you. And adults, as opposed to kids, more often than not, require just 3 years with the implants in place before they can be removed. Next slide. So we're going to ask Neil to join us now. Neil, to date, is the oldest patient that I've operated on, and Neil's journey is unique in so many ways. So Neil, thank you so much for your continued support of this community, and I really appreciate you sharing your journey with the community.
Hello, everyone. My name is Neil. I am from Alaska, and I was born with a severe case of Pectus excavatum, and it really didn't bother me growing up. It was something that I lived with. I didn't have any symptoms really to mention, any symptoms that most people typically have. In grade school and middle school, I was quite active in track. I ran competitively in the 100, 200, and the 4x100 relay. Didn't have any problems at all going through high school, really. Yes, I got made fun of, but that's just one of the things that you kind of deal with. By the time I got to an adult, I was doing just fine. And then in my mid to late 20s, I started to develop some chest pain. And so I went to a cardiologist, and the cardiologist did an echocardiogram and diagnosed me with mitral valve prolapse. That cardiologist put me on some beta blockers and then recommended that I do a fair amount of cardiovascular activity. So I started running. I started off quite slowly. I only ran about a quarter mile every day. And then after 2 or 3 days, I jumped that up to a half a mile. I did that for a few days, and then I jumped up to 3/4 of a mile, and then so on and so forth. And then I would say after about probably 2 to 3 months, I was comfortably jogging about 3 to 5 miles a day without any problems at all. Like most people with Pectus, my endurance wasn't nearly as good as anybody else my age, but I could definitely run for my own comfort level to do what I needed to do to address the issue. My cardiologist was involved in a rafting accident and died. And so the new cardiologist that saw me ran some more tests. The mitral valve prolapse, because of the cardiovascular activity, was no longer there. And the doctor felt that I was over medicating, so he took me off everything and essentially said, go live your life and have fun, to which I did. And then in my late 40s, I started to develop chest pain again. And I realized that at that time, it really wasn't my heart, that it was the Pectus that was causing the problems and issues. I found Dr. LoSasso actually by accident. I was doing a Google search, ran into a blog, and there were a number of comments and posts there about the Nuss procedure. And after doing a little bit more research, I found Dr. LoSasso in San Diego, set up a video appointment with him. He took a look at me and my chest, indicated that I was a good candidate as an adult patient to consider the Nuss procedure. I did a couple of the tests here in Alaska. For example, I did the metal allergy test here, and I did one other test that I forget which. And then afterwards, I flew to San Diego. This was when his office was still in San Diego. I flew to San Diego and met with a number of the doctors that he worked with closely. And after going through a number of consultations and reviews, it was deemed that I was ready to go for surgery. I have to tell you that I didn't have any problems or questions whatsoever about having the surgery. Didn't bother me one bit at all to have the Nuss procedure. And so I did. Surgery for me lasted 6.5 hours, as you can imagine, because I'm a little bit older than a lot of people. It was going to take some time, and I did have the rule track retractor used on me, and you can kind of see that in the picture there, right in the smack in the center of where all the electrodes are attached to me. Right there in the center is where you can see where that device was used. After surgery, I was in the hospital for 5 days in the ICU. They did a epidural on me, and that was my pain management to begin with. And then once I was released from the hospital, my pain management was Percocet. So I was on Percocet for about a week, and then I gradually weaned myself off of the Percocet and then simply used either Tylenol or Advil as a pain reliever. I stayed in San Diego for 4 weeks. I wanted to make sure that if any problems or issues arose, that I was close by. And so I stayed close to Dr. LoSasso's office. The first 1 to 2 weeks after surgery, I was walking short distances. And then when I went in for my 2-week visit, they were all curious to find out how my pain level was. And I have to tell you from my own experience, there wasn't hardly any pain at all. I would describe the whole Nuss procedure as pressure more than pain. You can definitely feel the bars inside you. So that for me, that was the pressure was there. But in terms of pain and some of the stories and things that you hear and read about, I would say that my pain level is probably a 3, maybe a 4 at the most. I came back to Alaska after the 4 weeks, started physical therapy. One of the things that Dr. LoSasso recommended to me when I got home was do yoga or Pilates or both. And I would highly recommend that to anybody who's considering the Nuss procedure. I think any of those activities prepare you well before and after surgery. I wasn't doing Pilates or yoga before surgery, and I think I would have benefited from it if I did. Now that, so the bars were in for 3 years, I flew to the East Coast where Dr. LoSasso is now, had the bars removed, came back home, and life for me has been one fabulous day after another. No problems, questions, or issues really whatsoever. If anybody asked me if I would do it again, I would say absolutely. No doubt about it. The 2 pieces of advice that I would have for anybody else, and Dr. LoSasso has mentioned this in a couple of his webinars before. The first one, which is the important one, is that the patient has to want the surgery. So it can't be a family member or any of the other family members. It has to be the patient that wants the surgery. And then for me, the other thing that I would say is, since I'm one of the older patients and you're thinking about it, I would say to anyone else, don't step in a pile of should-haves. Don't get to the point where you're in your 50s, 60s, or 70s and asking yourself, maybe I should have done this, maybe I should have done that. If you're really thinking about it, from my standpoint, I would say go for it, do it. It's a life-changing experience, and I think you'll be better off if you do.
Thank you, Neil. Thank you very much. Are there any questions? Are we going to take questions at this point? Is there anyone with a question for Neil? Okay.
We have one question on chat if we want to take it right now. For Neil, may we know what your Holler index was? Also, how did your endurance improve after the procedure?
My Holler index was 7.6. So as you can see from the pictures, it was quite severe. I did the incentive spirometer just before surgery, and it was, I could do at my best 3250. And then the day of surgery, right after I came out, I was doing 3250. The next morning, I was at 3750. By the following night, I was at 4,000. So immediate improvement right then and there. Can't say enough about it. Great experience.
John, hopefully that answered your question. We have another question from Matthew. Matthew, if this is specifically to Neil, go for it.
Yeah, two questions. One, Neil, how old exactly were you when you had it? And then my second question is, for those 3 years where you had the bars in, was there like anxiety about what are you gonna do about these bars inside you? Like, how did you deal? Because I feel like you skipped over those 3 years with the bars in you, like a little
Sure.
bit of experiences in those 3 years.
So I had the surgery just before my 50th birthday. Um, the bars, while they were in, I didn't have any problems or issues whatsoever, no anxiety whatsoever. You hear the stories of the people hearing the bars click. Yes, you will hear the bar click and you'll feel it click. That wasn't a problem or an issue for me at all. Also, you might hear people with stories. Dr. LoSasso uses the stabilizers, and I had mine on my right side for both bars, and I had 2 bars in. Those stabilizers there didn't bother me at all. I could feel them, yes. It took me a little while to get into a comfortable sleeping position. A lot of people use the wedge pillow to sleep in. I felt more comfortable with a number of pillows stacked up behind me. My wife had to help me get out of bed a time or two if I had to use the restroom at night. But otherwise, I was back to sleeping regularly, I would say, after about 2 months. The rest of those 3 years, no problems or issues. I am an active golf player. I was swinging a golf club comfortably. This is my own decision. I probably could have done it sooner, but I was swinging a golf club by 9 months, tentatively at the very first. And then I'd say after about 5 practice swings, I went after it full bore. And to give you an idea of what your activity level is in terms of actual rotation and twisting and turning, no problems whatsoever. I would say that there is only one thing that I would caution everybody against, and that is sneezing. If you have the bars in, especially right after surgery, and you sneeze, it's like having 1,000 knives stab you. I sneezed once, and then I learned how to not sneeze again, and that helped me tremendously. And if you want to know that trick, you just have to take your finger, push it up against the bridge of your nose as hard as you can for as long as you can, and that'll stop you sneezing. And I hope that answered your question.
Thank you.
Hi, Robert, you're up.
Hey everybody, I'm Robert Mills. I'm from Birmingham, Alabama. I grew up in rural East Tennessee and noticed that I had Pectus, or noticed I had indention in my chest. I don't know that it really had a name to me in middle school or high school, but I just noticed that my chest was different than everyone else's. It didn't stop me from playing basketball or playing tennis or living life, but it did stop me from readily taking my shirt off or going to the beach or going to the lake and taking my shirt off. So my parents noticed this, and I went through all kinds of tests to rule out Marfan syndrome. I did not have Marfan syndrome. I guess they thought I had Marfan's because I was tall and lanky, but that was ruled out, and doctor was like, hey, no Marfan syndrome, go and live your life. Went and lived my life, went to college, went to pharmacy school, and you know, I still knew something was different. Never knew it had a name. After college, I remember seeing if something could be done. So I had no idea it was Pectus excavatum. So I actually contacted a plastic surgeon saying, hey, I have this hole in my chest. Can you fix it? And the plastic surgeon emailed me the next day, said, hey, that sounds like you have Pectus excavatum. Okay, finally a name to what's going on in my life. And so after a few Google searches, I found that there are a lot of people just like me. And I think there was a website or a blog, and maybe Neil was referencing this. I think it was Pectus.com, and it was a message board that had all kinds of people with Pectus journeys and people that had not had surgery and people that had the surgery. But one name kept popping up, and that was Dr. LoSasso. So I contacted Dr. LoSasso when he was in San Diego. This was about 10 years ago. And he said, yeah, you know, we can take a look at it and go through this variety of tests. So I again went to rule out Marfan's. I still didn't have Marfan's. went to the cardiologist and had chest x-rays and CAT scans and all that done. And I was a candidate. But at the time I was running several businesses, and it just was not the right time to do the surgery. Looking back, I wish I'd done it 10 years ago, but at that time, it wasn't the right time for me. Now, fast forward 10 years, I sold the business, and I was like, I've had this in the back of my mind for 10 years. I'm going to see if it's time to do it. I still was a candidate. Dr. LoSasso had moved to New Jersey, and I knew that. I still remember the message board. I still remember that, all that was going on. There's new message boards on Facebook and other places, and there was no other option for me other than Dr. LoSasso. So I went through the variety of tests again, and went through months of testing, and dealt with Dr. LoSasso and Allison and Linda and billing, and everyone in the office is just nothing short of amazing. And so everyone that's on the call, I continue thanking you for that. I had my surgery about 6 months ago, December 11th of 2020, during COVID. The hospital was great, even though my fiance could not visit me. Pain management was great. Pulmonologist was great. The nursing staff was great. Therapists were great. Everyone between the time that I arrived in New Jersey till the time I left was just made it an easy journey. After the surgery, I was in ICU for 3 or 4 days, I think it was, and Dr. LoSasso uses a nerve block. I can't remember the Expril, maybe. I don't know what the name of it is. And I remember the night it wore off, and it was rough. But other than that, the pain management was really not that bad. I didn't hit the dilaudid pump, but once or twice a day. I had trouble moving around, but that was to be expected. I was expecting much worse. Now, the first month was, if you'd asked me during the first month if I would have done this again, I may have questioned my decision, but looking back now, I would do it again in a heartbeat. The roughest things for me were coughing, laughing, and yawning. Those were I dreaded every night when I would get tired to have to yawn. Laughing, I had to learn what I could and could not watch, or could or could not hear, preventing myself from laughing. And coughing was just, it just hurt. Now, I didn't sneeze for about 4 months after the surgery. Zyrtec was my best friend. I know Neil pushed his finger up to his nose, but Zyrtec was the way it prevented me from sneezing. And being in the allergy capital of the world, Zyrtec is still somewhat my best friend. I think I was prescribed 20 oxycodone, and I still have 5 left. Gabapentin and ibuprofen were my best friends. After physical therapy, I felt great, and I couldn't stand sitting around anymore. So after 3 months or so, I had my tennis buddy and I started hitting some tennis balls, and I now go to the gym 2 or 3 times a week. I'm not taking any meds in a couple months. Going to the tennis court now and not being short of breath after a half set of tennis just makes it all worth it. I feel that Dr. LoSasso and his team have changed my life, and I'm 6 months post surgery and just feel this was well worth it. It changed my life, and like I said earlier, I wish I hadn't put it off for 10 years. It's been not an easy experience, but one that is manageable, and getting married in 3.5 weeks, going to the honeymoon. I don't have to worry about being reluctant and taking my shirt off. It's life changing. So thank you, Dr. LoSasso.
You are so welcome, Robert. And you were right. The blocking agent, the intercostal blocking agent, is called Exparel, and it generally lasts for about three days, about 3 to 4 days, depending upon one's individual metabolism. And then one needs to transition from that to the other medicines that you mentioned, gabapentin, some medication for muscle spasm, which for me, I prefer Valium, and both Tylenol and Motrin, Tylenol and ibuprofen, just as you said. And that cocktail seems to work very well for all adults. And if the need arises, there's always some narcotic given. And I agree, Robert. I think your experience with using less than the full amount given and using it judiciously and it being necessary for a week or so is about what most people experience. So I think your depiction of your pain management is pretty standard. Just to make clear to the audience, when Neil's operation was done, we were still using thoracic epidurals and PCAs, and then the cocktail, the multimodal cocktail that I just described. And now we're no longer using epidurals and using intercostal nerve block and the multimodal group of medications that we just described. So just in the course of the individuals in this webinar, in the years that these individuals have undergone the procedure, I think we've evolved in terms of pain management for adults, and I am convinced we've gotten considerably better in terms of meeting the needs that are unique to the adult experience.
For all of you that have just joined us also or never been on one of our webinars, we do have a webinar specifically recorded on our website regarding Dr. LoSasso's pain management techniques and a discussion of all the different versions of pain management that are offered by other surgeons on our website at nussprocedure.com. If you click on webinars, there's a recording there. We do have a question again, and if all future panelists know the answer to this question and can include it, John asked if, Robert, what was your Holler index, and did you have improvement with endurance as well and your age of surgery? So going forward, future panelists, if you can include that age, endurance, and Holler index. But Robert?
Yeah, I was 47 when I had the surgery. That was 6 months ago. I think my Holler index was right at the edge for insurance coverage. I think it was 3.2. And yes, it did improve my endurance. Dr. LoSasso and Allison were talking about how my chest deformity was more wide than pinpointed to one area. So, but yes, it improved my endurance. I remember before surgery, I could, people would always say, oh, you have a runner's body, you must be a runner. And so I tried to take up running one time. I could run about a quarter to a half mile and just be buckled over in pain and coughing up phlegm and hands on my knees trying to catch my breath. And now in 90-degree weather playing tennis, it's made a huge difference in how I can run and keep my breath. And it's like I say, I would do it again in a heartbeat.
I think Robert's case illustrates a very important point that I would like the community to understand, that the Haller Index is a single modality for determining severity, but it is not the be all and end all. And like any other technique that we use in medicine to stratify patients and categorize patients in terms of severity, there are individuals who are somewhat unique in the ability of the technique to fully assess severity. And Robert illustrates that point. He was very symptomatic. He did have some compression and displacement of his heart, but the uniqueness of his deformity was such that it involved, as you can see in his pictures, a considerable amount of his anterior chest was depressed, but it wasn't severely deep in any one particular place. So it was more global than focal, and it sort of fell through the cracks a bit in terms of one's ability to accurately assess its true severity. So again, the Haller Index can be excellent for some in determining and stratifying severity, but there are the occasional individuals like Robert where it underestimates severity.
Paris?
Yeah. Hi, everybody.
Awesome.
My name is Paris. I have a similar story to what Robert and Neil said. I noticed my deformity probably mostly going through puberty, though going back at old family pictures, even as a baby, you could see a slight kind of asymmetric line going through my chest. As I grew and my deformity grew along with me, I started getting symptoms like chest pain, kind of like general lethargy. I would like run track, and just like everyone else said, despite the fact that I should be built for it, I just couldn't endure the same way that other people my age could. I had a really difficult journey to eventually getting the surgery done. All of the medical experts that I visited as a kid didn't really know what my condition was. And I remember being 16 or 17 and being told by my doctor that I'm too old to have surgery performed. And I would periodically kind of go on the internet, look up everything I could about the procedure, different doctors who do the procedure. I would go out and try and get something done about it again. And for one reason or another, I'd always end up kind of getting kind of turned down or let down and discouraged. I remember once I was sent to an orthopedic surgeon who, just told me this isn't really what they do. So finally, this past summer, I did my research again. I was in quarantine. I felt like I had time to finally have something done. And I found Dr. LoSasso's office on a website. For some reason, I can't find it anymore, but it had a list of thoracic surgeons. And Dr. LoSasso was like one of the few surgeons on there who had hundreds of reviews. So I reached out, and I'm still amazed at how quickly everything happened. I reached out to them in August, and I had my surgery done in October. So the entire workup was pretty much done in 1 month, and I had a procedure done that I've been thinking about doing my entire life, and seemed for one reason or another just hard to get. And everyone at that office has been completely incredible and so helpful throughout the whole thing. I was 29 when I got the procedure done back in October, and my Haller Index score was about 6.5. I've had 3 bars in my chest now since then, so it's been about 8 months. And I've been exercising like I used to before the surgery. Pretty much fine. I haven't felt limited in any way. At first, when you get your surgery done, you'll notice that Sleeping, I think, was the hardest part. I'm a side sleeper. I used a recliner at first to help me through it. And even at this point, I noticed subtle changes that make things easier and easier. Yeah, if you guys have any questions, I'd be happy to answer them. No, all good?
I'd like to interject something. Paris, thank you so much for sharing your journey. I have some things about Paris's journey that I think resonate with I'm sure a lot of adults in the community. One of which is getting erroneous information as you reach out to individuals thinking that they may be able to guide you to both the evaluation and possible treatment of the condition. And I just want to caution people that not all thoracic surgeons or pediatric surgeons have extensive familiarity with this condition. And so be very, very careful and very mindful of the uniqueness of individuals who have the proper credentials to both diagnose and treat pectus excavatum and pectus deformities in general. It's a very unique subset that requires very specific training. And once that training is achieved, it requires a number of years and multiple procedures before you are highly competent to do the more difficult cases, which in fact are people like Paris and the other adults who are presenting their journeys to you this evening. Paris, for instance, required maximal therapy. He required a forceful distraction of the chest. He required 3 bars to be inserted into his chest in order to fully correct and resolve the entire deformity's impact on his heart. And so that kind of advanced capability is important for you, the patient, to know your doctor, your surgeon has within their prior experience, just in case you're the next Paris and requires those advanced techniques and maximal therapy in order to achieve, an optimal result. So this evening, you're going to hear Paris's story, and you're going to hear some other stories where it will be clear to you that picking the right person, a person who is experienced in doing the adult procedure, is critical when you're an adult seeking assistance.
Yeah, and I see some people had a question about weightlifting. So I started weightlifting 3 years ago because I thought it would help my pectus. And I started going back to weightlifting as soon as physical therapy was done, which was 3 months. I kind of stayed away from free weights for the most part at first, just because it felt somewhat uncomfortable. You could kind of feel the bars slightly kind of like, or maybe even the scars even, not necessarily the bars, tugging about and pulling at first. But now I'm exercising 5 or 6 days a week, weightlifting. I'm probably lifting slightly more weight than I was before the surgery even. And in terms of how long it took to recover, I feel like I'm still, it's been 8 months, so I feel like I'm still part of that in that recovery process. There's a huge curve to it. The first week is a massive difference. The first month is a massive difference. And then between like week 6 and 8, you'll notice subtle differences from there. At this point, I sleep much more comfortably on my side. I lie prone just because I feel more comfortable lying prone. Working out hasn't been an issue at all for me at this point. And I would say, if you do get the procedure, which I highly recommend, just get it done as soon as you can. You know, do your physical therapy, obviously check in with your physical therapist, and just slowly start your way back up. And in a matter of a few months, you should be fine. I don't know if I missed anything.
Hey, Paris, couple questions. Do you know what your Holler Index was when you got started? And do you think your endurance has changed in general?
Yeah, I'm pretty sure my Holler Index was about 6.5. It's hard for me to say with endurance because I trained a lot before the surgery and running and going uphill and doing a lot of cardio. And I haven't done that as intensely as I did before. And it's hard to really get a sense of it because I still have the bars in my chest and they don't hurt or anything like that. And I think Neil made the point that a lot of times when you see people talk about the surgery, they'll say it's painful, and it wasn't the right word. Pressure, like you said, is definitely more of what you feel at first. At this point, I don't feel any pressure, but I am somewhat conscious of the bars, especially depending on the activity. Like if I'm bench pressing or if I'm sprinting all out and my lungs are really moving, I'm aware of them. In terms of my endurance, I assume that it has improved, but I haven't pushed myself in that specific category as much. I mean, I'll really be curious to see once the bars are taken out, what it feels like to do those sorts of things. Because even when I had my Pectus, I would notice that felt like a hindrance. And right now I don't feel a hindrance at all, but I am conscious of the bars.
So
Yeah, Paris. So some people did ask again about weightlifting, and this doesn't show up on our video recording. How soon did you start weightlifting? And it's more in your mind about feeling pressure, or you're boosting things up?
Well, at first it was definitely like in the hospital, you definitely feel like there's a pressure on your chest. Overall, I wouldn't be too worried about pain or anything like that. I think a lot of times it's overstated. The worst part of the whole process is when you're switched off of your epidural, I think around day 3, and you're switched to oral medication. And the maximum amount of pain when I was asked I've ever reported was a 7. Other than that, it's just like a slight, maybe, you know, you're conscious of the pressure when you first come out of surgery. You're very aware that you're not going to be able to lay on your side. You'll just feel it instantly that it's just not something you'd want to attempt. And then in a month, 2 months, it's a huge improvement. You hardly have any kind of discomfort at all. And when you're at my point, 8 months, you really don't have any kind of pain whatsoever. In terms of weightlifting, at first, during like physical therapy, the first 3 months, I mean, you'll go through with your physical therapist. You do some like rows, things like that, single arm rows, mostly different stretches. Towards the end of it, you'll actually bench press with a very small amount of weight, assuming that you go through a similar kind of physical therapy program. And then when I was on my own in the gym, I pretty much went back to all the standard weightlifting exercises: bench press, shoulder press, flies, rows, pull-ups. You'll be aware of the bars at first, but it's not painful or anything like that. I don't think it will really hinder your exercise either.
I'll take a stab at the endurance question. I would say that most people, and now I'm talking about high functioning athletes, because, you know, there is a wide variation in terms of how people's endurance improves. So I'll just use the high functioning athlete as a standard and as an example. But most athletes find that their endurance is markedly different by somewhere between 8 and 12 months after the procedure. And I think that is pretty common across all aerobically challenging sports. So I'm talking about people who are swimmers, who are runners, who are endurance athletes, they start to really sense a significant change in their endurance somewhere after 6 months, with a real sense that they have improved significantly at about a year.
Hey, everybody.
Hi, Chris.
Hello. My name's Chris. I am 28 years old. I'm from New York, about 30 minutes away from Dr. LoSasso's practice. My Haller index was, I believe, a 4.7. And just a little bit about my journey. When I was born, when I first started going for my first checkups with my parents, my doctors had told them that I had a little like divot in my chest and that it was completely cosmetic. There was no reason to be alarmed or concerned. But as I got older, around puberty, like Paris had mentioned, and I started to grow, I was growing really quickly and very tall. I'm 6'6". So as I was getting older and maturing, my pectus was getting worse. And, you know, I kept going to doctors, different pediatricians, different general practitioners, and just asking them what they thought. A lot of them told me it was just cosmetic, not to worry about it. Some of them didn't even know what it was. I had a few weird looks from doctors, which wasn't a great feeling. And around the age of 18, I started to get a little more thoughtful about what could happen down the road. Hypothetically, I had done my own research online, just trying to figure out how bad this could be for my health when I got older, if I would have any heart issues. You know, I was tested for Marfan syndrome, which I didn't have, but it kind of stopped with that. You know, like life happens. The prospect of going through surgery was very scary to me. You know, I had done research online for a while about surgeons, and Dr. LoSasso's name kept popping up. But, you know, he was I'm in New York, he was in California, so he just seemed, you know, a million miles away. And just the idea of going through a surgery that was already very scary to me, and then traveling was always, you know, a huge burden. But it was always on the back of my mind. And then in 2019, I don't know how this happened, but I was watching Ellen DeGeneres, and I heard an actor mention that he had Dr. LoSasso perform his Nuss procedure on him. And I kind of said to myself, all right. And then I went back and I Googled Dr. LoSasso, and I saw that he had moved his practice to Paramus. And I said, okay, this is now becoming a matter of when, not if, because it was always on my mind. I was always very active, doing a lot of running, weight training. And I noticed as I got into my mid to early 20s, I was feeling, you know, I was kind of plateauing in my endurance. Like I could run about 3 miles, and then anything after that, I was pretty much, I couldn't do anymore. And like Paris, I met with Dr. LoSasso and I met with Allison over the summer of 2020. And it was a really, really quick turnaround time in terms of speaking with them, figuring out what sort of testing I needed to have done to see if I was a candidate for surgery. And then in October 30th of 2020, I had the surgery done. I was in the hospital for, I believe, 4 days. I think my pain at the worst was like a 3 out of 10. You know, I was really amazed at how exact the pain management was. And then I think just overall, the worst part of the recovery immediately after surgery was driving from the hospital back to my home in New York, just hitting every bump on the highway. That was the worst part. Other than that, my recovery was nowhere near as painful as I thought it was going to be. I kept waiting for it to be painful. And it wasn't. Like, I felt pressure, I felt tightness, but I wasn't in this agonizing amount of pain that I had read so much about online. And, you know, I followed, you know, Dr. LoSasso and Allison's tips. You know, I was patient with everything. I went for walks when I was, you know, feeling up to it. And then I found a great physical therapist who also had never heard of Pectus before, and I was his first encounter with Pectus. And he did a tremendous job of getting me back to having my mobility, like lifting my arms over my head. And then around like the 4 or 5 month mark, I had pretty much full mobility, and we were starting to treat my physical therapy sessions twice a week, kind of like workout sessions. So I would do like strength training, like rows and pull-ups and bench presses. And then I would do some high endurance training just to see how my lungs felt. Everything from like high knees to just like running back and forth in the office. And it was pretty amazing when I went for my first run after about the 6 month mark. You know, it wasn't a very long run. It was like maybe a mile. But I could feel like immediately, it was really bizarre. I could feel more air coming into my body, into my lungs. So it was just, you know, really amazing at how well I hit like every benchmark that Dr. LoSasso had told me that I would hit, and, you know, with really scary accuracy. And then now, 8 months later, you know, I'm back at the gym every day. I'm running, you know, 3 to 5 miles, about 2 or 3 times a week. You know, lifting weights, bench pressing, shoulder pressing, deadlifts, you know, everything like that. You know, it took me a while to get back to core exercises besides planks, just because of like any sort of like twisting motions I was trying to avoid for a little while. But, you know, it was, you know, probably the best decision I've ever made. I'm eternally grateful to Dr. LoSasso and Allison and Georgia, Kim, both the Lindas. You know, they took the time to answer all of my what seemed like repetitive questions about whatever it was that was bothering me, because it was a very stressful decision and like period of my life to decide to go through with the surgery. But I don't regret it for a minute. I would do it all over again if I had to. And any like tips I would give, just trust Dr. LoSasso. You know, if you know he knows what he's doing, without a doubt. Trust that everyone has your best interest in mind. There's no judgments when you go into the office. They understand what this process is like and how stressful and nerve-wracking it can be. They're all very calm and very, very caring and nurturing. Sneezing, it's not going to be fun. I'm not going to lie. I went about 6 months without sneezing. I actually sneezed for the first time my first day back at work after recovery or my surgery. But it wasn't as painful as I thought. It was just kind of sore, and I felt some pressure in my chest. And I don't know if I'm forgetting anything. Sleeping, I slept in a recliner. I was always a side or stomach sleeper, so I kind of had to like will myself to be a back sleeper, to the point where now I think I'm just going to be sleeping on my back forever, just because that's more comfortable now. But yeah, I think that's everything.
Thanks, Chris. That's great. We'll move on to the next person. And then anybody who's asked regular general questions, we will address those in a little bit at the end. Okay. Everybody will be available for that. Tyler?
Hello, everyone. So I want to preface my Pectus journey and story, but just by saying that, like, if you're an adult, the only person on this planet Earth that I would trust to do this surgery is Dr. LoSasso. He's incredible. His staff's incredible. Both Lindas, like everyone said, like the best experience you'll have, bar none. I owe them. I'm like forever grateful to Dr. LoSasso and his entire team. They literally saved my life and changed my life for the better. So I just want to preface that my story with that and let people know that you're not alone. There's a bunch of people that were in your situation, and if you want to reach out to me, I will be here no matter what. Like, you can email me, text me. I've had people reach out to me on Instagram. So just know that, like, you're not alone. There's people that have been through this before. And to learn from my mistakes, because as you'll hear in my story, I trusted the wrong people when I shouldn't have. But yeah, anyway, so my story starts off very similar to a lot of the guys that have previously spoken. I knew that I had something wrong with my chest growing up. I had a sunken chest. I noticed that when I took my shirt off at the beach with my friends, that my chest was different than everyone else's, but still was on the swim team in high school, track team, and cross country team. I wasn't performing as well as my peers, but I could still run and compete. And it wasn't until like middle of college that my symptoms really started to show up and become a problem. I would wake up in the middle of the night with chest pains, thought I was having a heart attack. I couldn't really work out as much. I should also preface that I had another growth spurt, just like Chris, who spoke before, like 6'6" and was like 6'3" freshman year of college, but went through another growth spurt like my end of sophomore year, grew another like 3 inches. So it was a little bit of a late bloomer there. And that's when the symptoms really started to show themselves. So fast forward to, when was it? May of 2015. I'd kind of been putting it off. I knew that there was something wrong. Like I said, growing up, like I went to a doctor, and at the time, I don't think even the Nuss procedure was a thing. And my mom took me to a pediatric, just regular general practice doctor. At the time, I was living on the East Coast in Boston, and they, like so many of the other people on this webinar have said, they just thought it was, you have Pectus, it's a cosmetic, it's not going to really affect you. You should be fine. Just kind of, live with it. Sorry, I'm kind of jumping around here, but but then so I kind of like just put it off. I thought that it was cosmetic because all the doctors before me said it was cosmetic. But then when the symptoms really started to affect me, I decided to do some research, and I actually did find Dr. LoSasso. I graduated from SDSU here in San Diego, and I, like so many other people, saw his name pop up on all of the message boards online, just saying how great he was and how awesome the Nuss procedure changed their life. And so I met with my general, family's doctor to see if I could get a consultation from Dr. LoSasso. And he said, he said that my case of Pectus was pretty severe, and he thought that I should see someone about it. lo and behold, my insurance company sent me to a different surgeon. Even though at the very beginning of all this, I had requested Dr. LoSasso, they decided to send me to a heart surgeon, a thoracic heart surgeon near me. And I met with him shortly thereafter, and he assured me that he'd done countless Nuss procedures before, and that it was just, you know, he made it seem like open heart surgery and the Nuss procedure were a walk in the park to him. And looking back, I should have seen the red flags and should have asked him more information on exactly how many Nuss procedures he had completed, and if more importantly, in our case, how many adult Nuss procedures that he had completed. Because as Dr. LoSasso will explain, the cartilage and the ribs in your bone, the older you get, the more stiff and rigid they get. And so it's a lot easier to do a Nuss procedure on someone who is still going through puberty and that cartilage and bone hasn't really solidified and fused together. So when you are researching potential Nuss procedures, like I said, the only surgeon I would trust is Dr. LoSasso to do this on anyone who's 18 or over, just because it's such a specialized thing. And a lot of surgeons aren't comfortable with inserting more than one bar, which is another huge thing because the bones are so rigid. But anyway, so here begins my nightmare, which is I hope everyone will learn from what I did and not do this. I get the Nuss procedure done by the surgeon who will not be named. And I wake up from being under and thinking, you know, reading all the blog posts online, like thinking like the whole point of the surgery is to pop your chest out in order to make more room. Oh, I didn't tell you guys this, but I had the Haller index. I think Dr. LoSasso can confirm this for me, but I think I had like a 7.5 or almost like an 8 Haller index. Is pretty severe. And it was so severe that it was displacing my heart and lungs to the left side of my chest. And so, yeah, I wake up from the surgery and to my amazement, I look down at my chest and it's exactly the same as it was when I went into surgery. At first, the doctor told me that everything went perfectly well and that there's nothing to worry about and that it would eventually pop itself out over time like braces. But then I found out that he was just lying to me. And so a couple of weeks after the surgery, I go home and I'm having a mini panic attack, wondering what's going on. Why is my chest still the same as it was pre-operation? And so I called Dr. LoSasso's office, and at the time he was in San Diego, and asked his staff if it was normal to still have a sunken chest after the Nuss procedure. And they assured me that it wasn't normal and that I should go in to see them as soon as I could. And I think that was around August or September of 2015. And I met with Dr. LoSasso for the first time. He's one of the nicest human beings you'll ever meet. He really takes the time to answer all of your questions, you know, talk you off the cliff if you're having anxiety or any worry about the whole procedure. As you can imagine, at that point in my life, I was pretty neurotic and just at a very low point in my life. And he kind of like talked me off the cliff and calmed me down and told me that, yeah, my chest should be popped out after the Nuss procedure, and that I had a surgical steel bar in my chest that was doing absolutely nothing. It was actually probably doing more harm than good because it was pushing on my heart and lungs, which is doing the opposite of what you're supposed to be doing, which is to pop out your chest, so to take that pressure off of your heart and lungs. So had I gotten in a car accident or something, it could have ruptured those vital organs, which is bad. So people who were talking about anxiety, I had some anxiety about that bar being in the wrong place. But like I said, Dr. LoSasso has the best bedside manner out of any doctor I've ever experienced. And he calmed me down and told me, yes, you probably should get the bar removed because it's doing absolutely nothing. And we probably should go in and do the Nuss procedure again properly, the right way. So there was about a couple of months. I had the first botched procedure August of 2015, and I think I had the second operation with Dr. LoSasso that following 2016. I think it was the first weekend of February. So my case is special, as you're well aware. So it was basically like 2 surgeries in one, the way Dr. LoSasso explained it to me. First, we had to take out the bar that was doing nothing from the first surgery. And then he had to put in the 2 new bars to actually give me the correct Nuss procedure. And I don't want to scare people away, because if you learn from my mistake and go to see Dr. LoSasso, it won't happen to you. But it was a 9-hour surgery, and yeah, I'm not gonna lie, it was scary to come out of being under for that long and to find out how long it was and all the things that you had to do. But Dr. LoSasso is a freaking magician, and he's an artist. You don't understand like how hard this surgery is, and like he's literally weaving these metal surgical steel bars around your most vital organs, and somehow does it perfectly. But anyways, I get out of the surgery and come to, and yeah, I look down, and this time, oh wow, I had the Nuss procedure done correctly, and my chest looks perfectly flat. And the pain, a lot of people are asking about the pain. I'm not gonna lie, there is pain. Like, it's a chest surgery, and that's one of the most sensitive parts in your body. But the pain management schedule and regimen that he had me on was perfect. Like, I think the highest pain I said was like a 5 or a 6. Even after that, they took the epidural out, I was on oral medication, and I think the highest it got after they took the epidural out was like a 4 or a 5. I mean, granted, everyone's pain situation is going to be different, right? Like, a lot of people's pain tolerances are different depending on your physical makeup and your body, and et cetera, et cetera. But yeah, I mean, I really didn't have an issue with the pain. I had way more pain after the botched surgery than I did after the double Nuss procedure from Dr. LoSasso. So yeah, pain really wasn't an issue for me, though. Like Chris said before, I'm also a side sleeper, and I had to get a medical bed for the first couple months. But then after, I think it was like 4 or 5 months, I was able to sleep on my side again. There's just minor discomfort. But yeah, pain really wasn't an issue for me. And Dr. LoSasso was very cognizant of not over prescribing opiates. I don't think I even was on OxyContin. I think it was only either Percocet or Percocet is an opiate. I don't know, I forget. But honestly, I still have like a ton of pain meds left over from my surgery, which was like 5 years ago now. Or no, 6 years ago. Time flies. Yeah, I mean, the pain wasn't an issue for me. But like I said, everyone's situation is different. One thing I really want people to know and to take away from my story too is that the insurance companies aren't your friend, and they don't want to help you out. All they want to do is spend the least amount of money that they possibly can. That's the whole reason this all happened, is because the insurance company wanted to use this cheaper surgeon that they knew would be cheaper than Dr. LoSasso. So yeah, it was all about saving a buck, and it nearly cost me my life, because like I said, had that bar that was in the wrong place somehow flipped or ruptured or bursted my heart, I would not be here talking today with you all. So like I said, I just want you guys to all learn from my mistakes. Also work with Linda. She's a freaking angel. Like I said, his whole team are amazing people that are all out to help you, and I have nothing but kind words to say about all of them. Yeah, I'll stop talking now.
Hey, Tyler, thank you so much. And we know you've been a huge proponent of Dr. LoSasso for years, and we really appreciate that.
course.
So, Dr. LoSasso, I have a couple questions that we've saved. I have one specifically for Tyler. We'll do the Tyler one specifically, and then Dr. LoSasso, if you want to wrap up, then I have a number saved that I'll get back to, if that's okay. So, Tyler, when did you have the bars removed in the grand scheme of things?
I think it was, shoot, when was that? 2018? It was before COVID. When did you move to Paramus? It was like a year,
Yeah.
2017. I think it was like the fall of 2017 or 8. Honestly, wait, 15, 16, 17. Yeah, I had the bars in for 3
I
years,
think it was
right?
18, Tyler. Am I
Okay.
on? Can people hear me?
Absolutely.
Yeah, you are.
Yeah,
Yeah.
yeah. So yes, it was 3 years. You were pretty. That was the only thing that was pretty standard about you, Tyler. To be
Yeah.
honest with you, is the fact that your body responded very well to, you know, the bars once they were optimally positioned in your chest wall. And just as you said, you recovered in a fairly reasonable period of time, albeit it was your second insertional procedure, and your body then also responded very well to the therapy, allowing us to remove the bars without any real difficulty 3 years later in 2018, if I'm remembering correctly.
I think it was 2018.
I
forgot
think
to add also, if people have questions, I'm lifting weights, riding bike races, 52-mile bike races, playing tennis, sailing, skiing, running, like doing all these things that I used to have trouble before, and now it's like a walk in the park for me. So it really is a life-changing procedure, especially if you have severe pectus. And like I think it was Robert was saying, like the sooner you get it, the better. Like don't wait. Like honestly, like your life will be tremendously better for it. Like the longer you wait, the more complications can arise, and just don't wait. Just get it done. Get it done by Dr. LoSasso. Sorry.
Thanks, Tyler. I think your journey is so special and illustrates so many important points. But I think the most important point is that you go to somebody who is experienced, and that as an adult, you are a very, very special patient just by virtue of being an adult. And that the older you are, the more limited the expertise is to address the uniqueness of your situation. So it's important for anyone contemplating at any time in their life a chest wall operation to find someone experienced. But in the case of an adult, it is extremely important that you find someone who is an experienced practitioner of the Nuss procedure. Don't let them bait and switch you into doing a open ravage procedure. That's unnecessary in adults. It can be, Nuss procedure can be done on somebody at any point in one's life journey. It's not reserved for the very young. You'll get that information at times. That's not correct, okay? And the Nuss procedure, and this is borne out by my experience of over 20 years, is as effective treating pectus in the adult as it is in the child. So that's extremely
and it's
important.
minimally invasive. The ravage procedure, which is what Dr. LoSasso is speaking of, is very invasive. They literally like rip open your chest wall cavity and replace the cartilage.
That's right. Yeah, it's a removal of the cartilage, not a reshaping of the cartilage. And that makes all the difference in the world in terms of one's outcome. in terms of Tyler's journey and the uniqueness of it, the other thing that's important to understand is that once the operation is done incorrectly, it is a threat to one's well-being, and it makes it very, very difficult to do the operation successfully. It took me 9 hours because I had to remove a misplaced bar from the chest, which required freeing all of Tyler's vital organs from the bar, which was not correctly placed before I
Yeah,
could.
wasn't it like stuck to the bar? Like my heart and lungs were stuck to the bar.
Yeah, your heart and lungs were stuck to the bar. Yeah, it's exactly right, because it wasn't where it belonged.
Yeah.
So, not to add anxiety to to people in the community, but it is so terribly important in not experiencing anxiety to go and find somebody who is who's experienced in doing the procedure on adults. That's really the most important take-home message of the evening. And I want to thank all of my patients. You guys are all heroes in your own way. To not only,
you're the hero, Dr. LoSasso.
not only to have the courage, thank you, Tyler, thank you, but you are a hero. Not only did you have the courage to take on your Pectus, but you had the courage to take it on twice and trust again. And that is as much about your character as it is about mine. And so I think you all display, the courage it takes to recognize that there is a problem that you want to address, and then undertake it, and knowing that it's going to require an operation and a recovery and a treatment plan that lasts for years. So those of us who do this operation understand that this is a steep climb, especially in the beginning, and that it takes a very special commitment from the patients who come to us in order to achieve an excellent result, as you all have achieved. So I just want to acknowledge all of you for the hard work that you did in your recovery and the courage that it required to address your condition. So thank you all for sharing your journey tonight with the rest of the world.
And now we're going to open it up for question and answer. I've saved a couple questions that have come up in chat that were better used at general questions, and then a couple specific ones. So don't leave anybody, we're not done. And please, please, please feel free to either chime in by raising your hand. If you hover down at the bottom of your screen share, there's a way to click and raise your hand and you can ask your questions out loud. I'll switch that slide in just a second as a layout for it, or just include them in the chat and we'll do first come, first serve. But I have saved a couple of questions for Dr. LoSasso to start with. Dr. LoSasso, tell us about how many adult surgeries you've done. How does that compare to other surgeons? What are your thoughts on that?
Well, as far as the experience of other surgeons, you'd have to ask those other surgeons. I've done over 1,000 Nuss procedures, and I would say about 20 to 25% of those have been adults, so well over 250 adult operations. And when I say adults, I mean 21 and over.
And as we know, Neil, you're one of Dr. LoSasso's oldest patients. So thank you for joining us tonight.
Yes, thank you, Neil.
So this is kind of a question. Neil also traveled all the way from Alaska to be treated by Dr. LoSasso, I believe first in California and then finally in New Jersey when Dr. LoSasso moved. Moez asked a question as a Canadian: how prohibitive is it coming from out of town? for the surgery. We do have a travel guide on our website about how long you need to stay in town, how to plan your couple of weeks there, when you come back, recovery time, follow-up. But Dr. LoSasso does treat patients from all over the world. Dr. LoSasso, do you want to add anything to that question about how hard it is as Canadian or from outside the US or even from across the US to be treated?
Well, let's start with across the US. You know, even when I was in San Diego, patients were coming to me from all over the country. So I guess I have a bias towards knowing what it takes to do the operation safely and a sort of experience that is substantial enough so that I can do the operation safely and follow my patient for a period of time afterwards, which is generally about a week to 10 days after discharge from the hospital. And I must say that, you know, in 99.9% of cases, when the patient leaves the area and goes back to wherever they're from, it's as standard for me as if they were going back into Manhattan from New Jersey. I just feel completely comfortable, you know, with that part of the process, and the follow-up can be done as well virtually as it can be in person. And so I really do feel that from my perspective as the provider, I'm very comfortable with it. I'm also aware of how anxiety producing it can be for patients when they wish to come to me, but they're at a distance from me. I would just tell you that we're experienced in doing this. It can be done safely. It does require some time beyond your discharge from the hospital to stay in the area to ensure that the initial healing and outpatient management of the patient is sufficient and appropriate to allow them to then travel to their home. But for, again, most individuals, that period of time is somewhere around 7 to 10 days, depending upon the severity of their case and how they respond initially to the therapy. You know, I think this summer I'm doing someone from Uruguay. I mean, people come to me from all over the world. So, you know, I do believe that it can be done and done safely. I'm willing to talk to anyone specifically who is considering coming from a distance and addressing their specific questions and concerns. So please, if you're at a distance, don't feel that that rules you out coming here to the Garden State and having me do your surgery at the Valley Hospital.
As mentioned before, we do have a great travel guide on the website that discusses how many days and hotel rooms. And we have updated the website as well to include what you should bring, some tips and tricks. Somebody mentioned a reclining chair from our board of panelists. There's a lot on the website regarding how to proceed if you're coming in from out of town, if you're just going home. Like Dr. LoSasso said, Manhattan is no different to him from San Diego. Plus, with Allison on board, she is Dr. LoSasso's PA. She is happy to do virtual consultations as well. So you can reach out via the website or the office and schedule a virtual consultation and get started with your testing and everything Dr. LoSasso needs to make some decisions and get started. we always have a lot of insurance questions, and on the website and after this video, when we have a recording, we will include the contact information for all insurance questions, because unfortunately it just does vary from person to person. Dr. LoSasso, we had a question about dissolving bars. Have you ever heard of that? Allison, you might need to chime in here too.
Yes, let me just say that I don't use absorbable bars. I know they exist. There was a period of time when we were trialing absorbable stabilizers that didn't work out for those of us who were using them. That they were creating some problems for patients, and so we discontinued their use. I think within about 6 months to a year of trialing them. I do believe that the stainless steel bar is the standard of care, and for those people who have a nickel allergy or a metal allergy, the titanium bar is the plan B in that instance, is really the standard of care worldwide. It does require a second outpatient procedure. I don't mean to minimize that, but I think that it provides the proper amount of lift for the chest wall, and it continues to provide that force until the day the bar is removed. And I think that that's a critical a factor in achieving an ultimate outcome. With a dissolvable bar, there's a point where the bar is no longer really creating the force that it did initially. And so I can't comment on whether or not that has a predisposition for recurrence or problems down the road. But I just think that it is still the standard of care to use a metal bar that is then removed at 3 years or more as an outpatient procedure, and that is the way to achieve the ultimate outcome for the procedure.
Dr. LoSasso, we had a question in chat. Have you had to reinsert bars for any adult patients who already had it inserted as children and then had it removed?
So the question, I'm going to paraphrase then. The question is somebody who had a Nuss procedure early in life, the bar was removed, and now the patient has recurred.
Correct.
If that is the question, I have not had the instance where I have treated a person later in life with a second Nuss procedure. I have had the experience of treating with the Nuss procedure either failed Nusses like Tyler's, or patients who had had the Ravage procedure earlier in life that then failed and were then treated with a Nuss procedure. That I've had experience with, but not recurrent Nuss procedures many years separated from one another. I have not had an experience doing that.
Dr. LoSasso, this question has come up a couple times. In adults versus children, teenagers, how long should the bars stay in? Can they be kept in indefinitely?
Great question. That's a great question. So let's talk about length of time first, okay? Because the short answer to leaving the bars in my opinion, and that of most experienced Nuss surgeons, is that the option does not exist to leave the bars in indefinitely. So with that having been said, in children, the length of time is dependent on growth. And so if you put a bar or bars into a child at some point in puberty, let's say 13, often they will be growing at a significant rate 3 years later. And we measure that rate of growth by measuring the height of the child. And if the child is growing at a rate of greater or equal to an inch in a year prior to the scheduled time for bar removal, then we wait. We wait another 6 months and measure the change in height, and continue to do that at 6-month intervals until in that 6-month interval, they've grown less than a half an inch. And when that occurs, whatever the age and however the duration, that's when I remove the bar or bars. In an adult, that's not necessary. That calculation is just not necessary. And what I tell adults is if the bar or bars are placed optimally, secured optimally, and are shaped in an optimal way. So there's a lot of ifs, but if all those ifs are achieved, then 3 years, in my experience, is enough time to successfully and permanently remodel and position the adult chest into a corrected position that will remain forever. So for adults, it's 3 years. For children, it's 3 years, and then you assess growth, and you only remove the bar or bars in children when the growth has receded to the point where it's safe to remove the bars. Because in children, if you remove the bars too early and further growth occurs, remember, you've not changed the genetics of the patient. And because genetics plus growth equal sunkenness, if you remove the bars too early in a growing patient with Pectus excavatum genetics, they will recur. To what degree they recur is usually less severe than what they were originally, but after you've undergone a Nuss procedure, any recurrence is to be avoided.
Dr. LoSasso, more specifically, what would be the harm in leaving the bars in too long, either with teens or adults?
Great question. So one is that the bar, though not at risk for displacement, is still putting pressure on the chest, and over a lifetime, that pressure could create problems anatomically within the chest wall that could lead to bleeding complications and to ongoing risk of infection, because as long as you have a foreign body in your chest, there's always the possibility, a very small possibility, albeit, but a possibility of that foreign body becoming infected. So erosion into vital structures and the ongoing risk of infection, though minimal, are reasons for removal. And when you look at risk benefit, which is the way we always analyze whether or not something should be done or not done, the benefit of a bar in an adult after 3 years is 0. right? Your the bars have worked their miracle. Your chest has been reshaped permanently. And so there's no benefit to having that in your chest at that point forward. So now the risk benefit is more towards risk than benefit. And as a result of that risk benefit analysis, all of us who do this work would recommend removal of the implants.
Dr. LoSasso, or actually Neil, this is a question for you if you're on here, Neil. I believe this was mentioned by you back in the very beginning. You mentioned clicking of the bars. Are you still on here, Neil?
I'm still here.
Ah, perfect. Thank you. So what did clicking of the bars mean to you?
I think Dr. LoSasso could probably answer this better than I could, but I think what the clicking of the bars is that the bar is a foreign object and it's occasionally rubbing against the inside of the sternum. And that I believe, from what I've heard from others in my experience, is what the clicking sound is. But I defer to Dr. LoSasso in terms of the medical side of that explanation.
Yes, so you're correct, Neil, in saying it is the ongoing force of the bar against your chest, but rather than the sternum, though it feels much like the sternum, what is happening is that there is ongoing realignment of the cartilaginous segment of rib, which, remember, it attaches, I'm going to stand now so I can use myself as a model, from your sternum or breastbone medially over to about an imaginary line from your collarbone through the nipple to the end of your chest wall. That line is where laterally the bony rib and the cartilaginous rib meet. So there are two joints, one medially where the cartilaginous segment joins the sternum, and one laterally where the cartilaginous segment joins the bony rib. And it's at those two connections where the bar is able to create enough force to move the cartilaginous segment into the alignment that the surgeon has predetermined would be optimal for you in the way that he or she bends the bar, right? So it's the bend of the bar, which is the artistry, that then moves the chest accordingly, and does so by moving that cartilaginous segment at either end where it's connected to the bony components of the chest skeleton. And that clicking, which often patients mistake for movement of the bar, is actually movement of the chest wall. It's movement of the cartilaginous segment, which is deformed, and moving it in a way that brings it into an alignment that the surgeon, in bending the bar, has predetermined would be a more optimal position for the chest wall to be in, both in terms of cardiopulmonary physiology and in terms of cosmetic outcome.
Dr. LoSasso, John has a question. He said, I heard patients on this forum mention 3 to 5 days they spent in the ICU post-surgery. Was the ICU time due to pain management protocol? How has the ICU time requirement and overall length of hospitalization changed with the introduction of cryo? And I'll just do a follow-up on this one really quick before Dr. L answers. We do have a video specifically talking about pain management on our website where Dr. LoSasso talks about all of the different options for pain management, including cryo and everything else. But so Dr. L, if you want to address this, or I can reread the question.
No, it's an excellent question. And let me just say this, that every hospital is a little different in terms of their internal culture. So when I was in San Diego at the Children's Hospital, there was an intermediate care unit where patients would go to for the monitoring necessary after a Nuss procedure. And at the adult hospital in San Diego, they were more comfortable with postoperative Nuss patients being in the adult critical care unit. In New Jersey at the Valley Hospital, they are more comfortable with patients who have undergone the Nuss procedure to be in their respective critical care units, both pediatric and adult. Patients who've undergone the Nuss procedure are not critically ill. So you're not, by standard definition, a critical care patient. What you do require is a hospital bed that provides you with the appropriate level of telemetry or non-invasive monitoring, such that your oxygen saturation and your heart rate and your blood pressure is being constantly monitored. And you need a bedside nurse who has critical care training, and most importantly, has specific Nuss training that allows he or she to be able to make ongoing pain assessments and do the appropriate interventions to minimize any discomfort that you may have. So that's the reason for critical care units in the course of providing Nuss treatment. The number of days that one is in the hospital is equal in my practice to the number of days you're in the critical care unit. So you go to the critical care unit, you're monitored there until you reach criteria for discharge, and then you're discharged directly from the critical care unit. In my experience, I have been able to achieve, on average, a discharge from the hospital 2 days after the operation. So you have the operation, you spend 48 hours in the hospital after the operation, so that's 3 days. And on the morning to mid-afternoon of your third hospital day following surgery, you are generally able to be discharged. And some patients actually could be discharged on post-op day 2. So that's a calculation that's made on an individual basis that has to do with how the patient and their family is feeling at the point where they have met clinical criteria for discharge. Allison, I need power. I hope that answers. And then there was the expiral cryo question, and I will just take that question very briefly because I know in the Pectus community there's a lot of debate back and forth about what is best. I think what's important for the community to understand in general is that intercostal nerve blockade, whether it's pharmacologic or through cryoablation, is really become a very, very beneficial adjuvant to performing this procedure. It has, excuse me, just one second. It has enabled patients to be discharged sooner from the hospital, and even while hospitalized, has significantly reduced the need for opioid medications. So regardless of whether you have a surgeon who's advocating cryotherapy or advocating long-acting local anesthesia, intercostal blockade is absolutely critical, in my opinion, in minimizing pain in the adult and, for that matter, pediatric populations. Now, with cryo, you're actually freezing the nerve within the chest wall at multiple levels of the chest, and you're damaging the nerve in doing so. The younger you are, the more completely you recover from that injury, okay? Because you're freezing the nerve. You're injuring the nerve, and in so doing, you are disrupting the nerve conducting pain impulse back to your brain. So it's a disconnect in terms of sensation between your chest wall and your brain. Exparel, which is long-acting liposomal bupivacaine, does the same thing pharmacologically. It does it for a shorter period of time. It does it for 3 to 4 days. During that time, your chest is changing and accommodating the forces of the bar in ways that pain management at 3 to 4 days post-op, in terms of the medications required, is much, much less and different than what it would have been immediately after the bars were inserted. And so in the older patient who may not recover fully from the injury to the nerve that cryoablation creates, then Exparel may be a better option for the older patient, because it has become known to those of us who do this work that some adults have a protracted period of time in which their chest returns to normal sensation. In the pediatric patient, in the adolescent patient, since they're growing, their recovery from that same thermal injury to their intercostal nerve is more complete and more rapid. So I think the bottom line for those of you who are thinking about which technique might be best for you is for you to have the information directly from your provider and to process that information and make an individual decision for one or the other. I offer both in my practice, and I think that the conversation has to be an individual conversation where individual patients and their provider go through the pros and cons of each type of intercostal nerve blockade technique and decide which is best for a given patient.
Dr. LoSasso, quick question. And I know we've addressed this. If you guys, again, I hate to keep harping on the whole webinar series, but we have had a number of ones about sports and the Nuss procedure and children in the Nuss procedure and exparel in the Nuss procedure. So we have a great question from Timothy. How soon can you exercise after the Nuss procedure?
Well, that's a great question. And I think the answer to that is immediately. I mean, I feel that walking and deep breathing for the first 10 days to 2 weeks after the Nuss procedure is both an imperative and is, secondly, exercise. It's appropriate exercise for that moment of one's recovery journey. Okay, so exercise is critical from almost day 2 when you begin to walk from the bed to a chair. And then that escalates into physical therapy in my practice at week number 2. After you come back, you see me, or we virtually see one another, however it's done, we then can determine where the patient is at in their immediate recovery and decide whether it's appropriate to go forward with physical therapy. I'm a huge proponent of physical therapy. I've spent a great deal of time thinking about physical therapy. I've spent a great time working with physical therapists to provide the appropriate repertoire of physical therapy. I've got a physical therapy program that I have devised with the help and collaboration of an excellent physical therapy practice in San Diego that I deeply believe in and advocate. And that should start at about week 2 for everyone. And that should be a twice-a-week program that continues for at least 10 weeks. And then after that, as I think it was Chris that mentioned it, he segued from a physical therapy kind of workout with his physical therapist to almost a personal trainer kind of more intense physical therapy. And I think that that's exactly how that transition should be. And it should be roughly at about 10 weeks post-op that one starts to begin to do what I call, for lack of a better term, sports-specific therapy or rehabilitation, where you're actually working out as you would if you were preparing to perform athletically, whatever that might be. And you're doing that without competing, without being, part of a competitive sports activity. And generally, I like people to do that sort of sports-specific level of physical therapy or personal training for about a month before they really start to do their sport with their teams and doing it at a more normal level. So now we're about 4 to 5 months post-op. And for those that do competitive sports that involves contact, body contact, then I say wait until 6 months before you're doing that competitively. So that would be something like, basketball, football, lacrosse, et cetera, et cetera.
Dr. LoSasso, do you use the rule track system where it pulls the sternum up before you insert the bars? I hear some surgeons do and some do not.
That is correct. I do use the rule track. I use it selectively. I use it both in adults and kids. And my rule of thumb for using it is if when I look into the chest for the first time and I see that the deformity is significant enough to make it difficult to safely separate the chest wall from the heart, and that's based on, you know, over 1,000 cases, then I make a decision as to whether or not to use the rule track retractor. So I think the important thing for the community to understand is that whether or not you use it or not is based on experience with using it. So anyone that you might consider to do your surgery, you need to make certain that they have a rule track in the room with them at their disposal to use if indicated, and they are experienced in using it both in adults and in kids. In adults, I think it's much more imperative that the surgeon be familiar with the instrument and have experience using it in the adult setting. Because again, attaching that instrument to the body is a little different in a adolescent than it is in a full-grown adult.
Hi, Jody. You have a first question in chat. I'm going all the way back up to where that is. I thought I'd made notes. Let's see. Can increasing pressure on the heart by one's PE result in development of hypertension?
Oh, it's a great question. That's a very sophisticated question. And the answer is yes, it can. It can cause increased pressure not only within the blood, with what we call systemic blood pressure, but it can more selectively cause aberrations in right-sided intracardiac pressures, more importantly. And that's something that can be appreciated when one has a cardiac MRI at the same time that they're undergoing an MRI of the chest wall to determine the Haller index or severity score. So seeing derangement or abnormalities in the circulation between the right heart and the lungs is critical for the clinician, for the surgeon, in determining severity and the possibility that something like the rule track may be necessary in order to do the operation safely and to prepare the patient for the fact, that likely multiple bars will be necessary in order to achieve an optimal correction.
Jody, hopefully that answered your question.
Yes, it has. I'm 71 years old. I was diagnosed with Pectus in 2013, believe it or not. It was literally adult onset sometime between 2006 and 2013. No one can figure it out. I've been waiting to see if my situation has changed any since 2015. I had the various tests done to echoes and volume of breathing and stress tests. Everything's been fine except in the last year. I've developed hypertension. We're not sure exactly why. My Haller index is 4.8. That's stayed pretty much the same. I've had it checked 3 times since 2013. And so I'm sort of in a situation where, I'm old, but, who knows if it's going to have any greater effect on my heart.
Well, I'll tell you, Jody, I think you present some very unique set of circumstances, and I'd be more than happy to help in any way specifically to answer your specific questions. I think it would require me, doing a little bit more extensive analysis of your unique situation in order to offer the kinds of opinions that I think you so richly deserve. So I would encourage you at some point to reach out to the office and talk with Allison, and maybe we can arrange a time when you and I can go over your case in greater detail, and then I think I would be more comfortable rendering a medical opinion specific to you, your condition, and possibly what your specific needs might be.
All right. One strange sidelight is 2 years ago, I moved from Florida to Oceanside, California, of all places, and you moved.
My old stomping grounds.
Right. I missed you.
Yeah, darn it.
All right. Thank you, sir.
You're welcome, sir.
All right, we have one more question here. How do you handle and predict rib fractures from the Nuss procedure, Dr. LoSasso?
Well, if the bar is placed in the appropriate position within the chest and the bar is shaped appropriately, there should be no reason for rib fractures to occur unless you have some predisposing condition, such as osteoporosis, which you can often see in older female patients, that would potentially predispose for that complication. But in general, if the bar is shaped properly and placed in the chest wall properly in terms of location, the incidence of rib fracture should be almost zero.
Thank you, Dr. LoSasso. Thank you all for joining us tonight. Does anybody have any further questions that we can answer? Otherwise, we would definitely love to hear from you. As mentioned before, Kim and Allison are both available on the website. Also, Georgia and insurance specialists are available calling the office directly. Kim and Allison can help you with that. We can do consultations without actually meeting with you in person, because thanks to Zoom these days, things have changed, hopefully for the better. One of the pros of COVID. Dr. LoSasso, do you have any final words?
Well, I would just like to ask the community, the patient community, to reach out to us with other topics that you think may be of interest to you in terms of increasing your fund of knowledge, and making you better able to have your questions answered and be better prepared for whatever your journey might be going forward in finding the right person or practice, and having a deeper understanding of what your condition means and what your options for treatment might be. So please communicate any topics or questions that you might have that you'd like us to address in this webinar format, because we're really here to meet your needs, to educate you and your families regarding this condition and prepare you so that you can find the right individuals and get the optimum treatment that really you all so richly deserve. So to that end, let me know what I can do to help. And we'll be back doing this again in another month. We'll send out an announcement so that you can all join us at that time. And I just want to thank all of my patients for their time and for their deep commitment to joining me in educating the community, the Pectus community. I can't thank you enough, gentlemen, for your time and for the great job that you all did tonight. Thank you so much. And to my team, thank you again for all your assistance, both in getting these webinars done every month, but also in caring for the patients who choose to come to us for care. I can't do it. I couldn't do it without all of you. So thank you very much, and good night to everyone. And we'll see you again next month.
Thank you. Thank you, Dr. LoSasso.
Thank you all.